Did you know that you can regrow your distal fingertip after an amputation? Welcome back to another episode where I help younger physicians decrease stress and increase income by transitioning from corporate to independent practices, even without any business experience. Welcome to another Did You Know episode, where we are discussing things that I didn't know and hopefully, and maybe you didn't know in medicine. And so this is a weekly series that I started last week, and I wanted to introduce something that came up at the dinner table. We were having dinner at our home, and for some reason it came up that I asked my kids if they knew that you can regrow your fingertip after an amputation. They're like, "No, you can't." I said, "Well, yeah, you can. Lizards do it. Lizards can regrow their tails." And I remember in medical school, there was a lecture on amputations and dressing changes, and I don't remember the detail, but I remember being fascinated by a lecture on amputated fingers, and we had a lecture that described how an amputated fingertip above the level of your distal interphalangeal joint, so the fingertip was cut off, and they were actually able to create a dressing that did not put any pressure on the fingertip. And they have found that if you don't put pressure on the fingertip, no tight dressings, that your finger can grow back just like it was initially after distal amputation. And this is something that I believe is related to the angiogenesis of blood vessels and tissues. And people don't realize that we have the ability to heal, but a lot of times we do things to our body that prevents it from healing. So in an article in 2014, there was a review that reviewed secondary healing of fingertip amputations, and it describes exactly what I remember in medical school, where secondary healing of fingertip amputations have pretty much the same results, if not better results in some cases, than primary closure. And yes, you have more risk of infections, but the outcomes seem to be about the same. But it does take a little bit longer to heal, and sometimes we are not patient with the healing process, but it does happen, and it can happen. So there you go. Well, thank you for listening to another Did You Know episode, and we'll see you next week. Thank you so much for listening to the podcast. If you'd like to hear more, subscribe, follow in your favorite podcast app so you'll never miss an episode.